Welcome to Path News Network Daily Edition from the College of American Pathologists. I'm Angela Panettiere. It's Monday, July 6th. Here are a few of the stories your news team is working on this week. Can certain details on an exam influence how physicians think? New research examines how patient demographics in exam questions can influence clinical reasoning and what that could mean for the future of patient care. An upcoming CAP Foundation webinar spotlights efforts to strengthen breast cancer pathology services in Kenya. The session examines how expanded in-house testing is helping pathologists evaluate response to therapy and guide care despite limited treatment data. What does it take to be media ready? We'll talk with Dr. Adam Clow about his experience with CAP media training and how it's helping him turn complex topics into clear, concise messages. But first, in today's story, pathologists are finding new ways to connect with the public and bring their work beyond the lab. At a recent event at Chicago's Field Museum of Natural History, CAP members engaged with visitors, sharing how pathology plays a role in treatment, diagnosis, and discovery. Dr. Juanita Evans was part of that effort, along with Dr. Keisha Mitchell-Richards and Dr. Christine Booth.
We had a variety of specimens present and just like teaching tools at this event. So anything from pictures of organs, so gross organs with interesting pathology. We had actual gallstones on site. We had a bone with osteosarcoma, which was super fascinating because I haven't seen one of those in maybe since residency. And then we also had like slides and some paraffin blocks, just kind of showing the whole process of what a pathologist could do in their day, or what a typical pathologist might do in their day.
For some visitors, those interactions left a lasting impression.
I had some pictures of a liver and a spleen with metastatic tumor in there, and the whole day I've been asking people, oh, do you know what organ this is? And that one young individual, I would have guessed he was maybe like 12 or 13. He's like, that's a liver. I was like, yes, you got it right, because everyone else has guessed that the spleen was the liver, but he was the first person of the day.
Following the public event, a smaller group of students interested in science and medicine had the chance to continue the discussion.
First of all, it gave me a lot more insight into pathologists and what they do, and kind of opening up like, hey, this is another career I could possibly pursue in the future. Also very empowering to see more women in STEM.
The conversation also touched on representation in medicine and the importance of reaching future generations of pathologists.
We're trying to do our best to represent the population currently of the United States, and so I think we, especially in our conversations with those interns at the Field Museum, we did touch on those issues of like how, as medicine progresses forward, we have to make sure we're not losing sight of populations that may not be as well represented. And that's once again where I was saying like pathologists play a huge role in making that advocacy effort happen.
We'll continue to bring you stories like this in the days ahead. That does it for the Daily Edition. Share this newscast with your social media network. If you're watching this video on YouTube, please hit the like button and leave a comment. And if you've got a story we should be covering, write to us at stories@cap.org. We're back tomorrow at 5 a.m. Eastern for another episode of the Daily Edition. I'm Angela Panettiere. Have a great day.